Welcome back to the Running Explained podcast. Hi, I'm Coach Elisabeth, and I'm here to break down the science of running in a way that actually makes sense. Whether you're training for your very first race, aiming for a new PR, or just trying to be a more balanced runner, this podcast is your go-to spot for all things running. At Running Explained, running is more than just about logging miles. It's about becoming the best version of you. That's why we talk about more than just improving your fitness, but how to support your physical, mental, and emotional health too, so you'll see improvements that go far beyond race times. And if you're looking for more support, I've got you covered. Whether you're interested in one-on-one coaching, following a structured training plan, or joining our supportive group coaching, I've got options to meet you where you are and help you level up. Ready to dive in? Let's go. Hey everyone, welcome back to the Running Explained podcast. I'm very excited to have you here today. And before we dive into the episode, I want to announce/remind you that this coming Tuesday night, so April 8th in the evening, Coach Nick and I are hosting a Your Best Boston Marathon webinar. It is going to be everything that I wish that I had known before I ran Boston, from a logistics and what to expect from when you show up in Boston for the weekend all the way through when you cross the finish line and are off to find a lobster roll for your recovery meal. There is a lot that goes on the weekend of Boston. It is a very busy weekend in the city in general. And then of course, adding the pressure of running a marathon to it, it can be overwhelming for a lot of runners. So for only $19, you can join us live or get the recording. It will be recorded and sent to you afterwards to learn everything that you need to know to crush your Boston, whether you are Boston bound this year or think you just might be Boston bound in the future. Come and join us next Tuesday, April 8th in the evening. You can find out all the information on our website, runningexplained.com. All right, now on to today's episode. My guest this week is Dr. Alyssa Ford, a physical therapist, runner, and she's an expert in injury prevention. So we're talking today about a topic, unfortunately, that we have to talk about a lot, and that is injuries, why they happen, how to cope emotionally, and what you need to know, the steps that you can take to become a more resilient and durable runner. If you have ever struggled with injuries, especially recurring or chronic injuries, and you just want to learn more, or maybe you're a newer runner who's come across their first injury, or an experienced runner who's now injured, hey, look, they happen to all of us, but there are things that we can do to reduce our injury risk and to help us recover better than ever. Let's dive in. Alyssa, welcome to the show. I'm so excited to have you here.
Elisabeth, thanks so much for having me. I'm really excited to be here. I'm really excited for our topic and to be able to dive into what we're going to be discussing a little bit more. I think it's going to be such a fun conversation.
Oh, 100%. And before we get started with our topic, I think a lot of runners will definitely benefit from. Go ahead and tell us, Alyssa, how did you become a runner?
Yeah, so I started running as a kid. My mom is actually a runner and a marathoner, so I started running with her just as something that we would do together. Sometimes it was a fun way for us to kind of spend time together. So I started running pretty young, and then as I got a little bit older, it became something that I just enjoyed doing. It was something that, it was a fun way for me to just kind of like clear my head. It was a good outlet or stress relief. But for a long time, running was something that I kind of just did on the side. I pursued other sports through high school and college. So it wasn't really until after college where I stepped away from playing other sports competitively that I turned to distance running. And I was kind of in this like weird transitional phase of my life where I finished college, was like figuring out my next steps with my career, and stepped away from playing sports competitively. I just really missed feeling like an athlete and being competitive. So I decided to train for my first half marathon as a new way to challenge myself. And then just kind of fell in love with the process of training and competing and racing from there. And now running is my whole life. So things escalated quickly.
As they tend to do. And I want to ask you about running with your mom, because a lot of the runners that I work with are parents, and a lot of moms, and a lot of runners who started running as adults who are now also parents don't necessarily understand the positive impact that being that runner parent can have on their kids. Because so often as parents, there's that guilt of, oh my God, I'm missing bedtime, I'm missing breakfast, I'm taking time away from my kids, I'm not being a fully present parent. But you are seeing your experience as the child of a runner. You're like, this is awesome. My mom's a superhero.
Oh my gosh, absolutely. I looked up to my mom so much and I thought it was so cool what she was doing. She was so dedicated to it. She would like sleep in her running clothes and wake up at 5 a.m. to beat the Florida heat and get her long training runs in. So I just looked up to her and admired what she was doing and the way that she was training so much. And it was really inspiring for me as a young kid. And I really owe it to her that I started pursuing running in the first place. And it's cool now, even so many years later, we still enjoy running together and we'll plan like going to the same races and stuff. So it's been fun, like having it be such a big part of our relationship for such a long time.
Do you always know you wanted to be a physical therapist, or did that come later in your collegiate career?
Yeah, that came later. I was always interested in exercise science and exercise physiology. So I was already studying exercise science in college when I tore my ACL and
Oh.
had to go to physical therapy myself. And that really just kind of opened my eyes to what physical therapy was. I knew of it, but I didn't really know like the details of how powerful it could be for helping people until I went through it myself. And I was lucky to have such a great experience. And I worked with a wonderful physical therapist who was like so, patient and helped me work through like the mental side of dealing with a really long injury and a really long recovery. So it really just inspired me to want to do the same. And I was just like, this is a really cool way to help people. I like being there kind of every step of the way and being able to celebrate those milestones. And there was nothing better than getting somebody back to doing the things that they love to do.
So before we dive into the meat of our conversation, I have three fun, quick questions that I want to ask you. Now, these are not like one word answers, but be like, yeah, what's that initial reaction answer to this question? So my very first question is, if you could have an all expenses paid guaranteed entry trip to any race in the world, what race would you choose?
Oh my gosh, this is such a fun question. I think I would have to say the Sydney Marathon because I have always wanted to go to Australia.
That's a good one to get the expenses paid for.
Exactly. That's what I was thinking too. It's expensive to get there. It's a long travel day. So,
And now it's a major, the seventh major.
so cool. Yeah.
All right, next question. What is your current favorite run fuel?
Ooh, so I've been really enjoying, and I will preface this by saying that I am pretty picky when it comes to gels. I'm like weird with textures and things and like certain flavors, like I just don't like. So it's hard for me to find a gel that I really like. But I've been doing the Crank Sports e gels, and I love them. Like all the flavors that I've tried have been really, really good. So that's been my go-to lately. I like all the flavors. I like that they're like a higher carb option. So that's been what I've been fueling with recently.
I love their watermelon flavor.
Favorite
It's the
too. Oh, it's
best.
so good.
Anybody here is a fan of watermelon. Maybe you were also a young millennial. Yeah, it's really good.
Probably because my other go-to like pre-run snack is the salted watermelon Cliff Blocks. So there's like a watermelon theme in my fueling for sure.
All right. And last question. What has been your all-time favorite pair of run shoes? Holy grail. I'd give my left hand to get these stocked in my closet for the rest of time.
Ooh, oh, I love this question. I think I would have to say the New Balance Rebels. I'm a big New Balance gal, and those are just my favorite. They're my go-to for speed work. They're my go-to for like medium distance long runs, and they're my go-to like race shoe. And I just feel like they're really comfy and cushy, but still light. And they come in pretty colors, so that's a bonus too.
All right. So, our big topic today, our big discussion, is one that I think a lot of runners will find helpful, but in the same vein, I hope that not many runners would find this helpful because we're talking about being an injured runner and stuck in that cycle of why do I keep getting injured? Because this is a big deal in our community. And I'll go even further to say this is a big problem, that recurring injury. Oh my gosh, I'm injured all the time kind of runner. Why did we want to talk about this today? Alyssa, what is the impetus for discussing this today?
Yeah, I think this is a great conversation for us to have because unfortunately, like you said, this is a really common experience for a lot of runners where they'll have an injury pop up and then, take some time away from running to rest until things feel better and then get back to running and then the same injury will pop up and then end up getting stuck in this cycle. And it can be super frustrating and super overwhelming and super just feeling like there's no way out. So I think because it's such a common thing that it's important to talk about. I also think that when a runner is experiencing an injury, it can feel like a really lonely experience. So just talking about this more openly and knowing that this is a common experience, I hope will be really helpful for the runners that are listening.
So the numbers are a little amorphous in that there's no exact number about, how many runners get injured every year. We have some general numbers. Something like 80 to 90% of runners will get injured in their life as a runner, which is, I mean, that's pretty close to everybody. Almost every runner is going to experience at least one running related injury in their running career. And then there's an estimate that between 40 and 50% of runners experience a running related injury every year.
Yeah, those numbers are crazy. Those are really, really high.
Why do you think they're so high? Like you and I were chatting before about how this should be unacceptable to us as a running community. We shouldn't be fine with half of all the runners that we know getting injured at least once per year. But
Yeah.
we're okay with it somehow because running is somehow, we're fine with that. Why are we fine with that?
Yeah, I don't know, it's become kind of like a normal and like accepted part of running, which is kind of odd, which I think too, it's okay. Like injuries are going to happen and it's not anything to feel bad about or feel guilty about. Like sometimes they just happen. But I do think that injuries are also a really good opportunity to take a closer look at things and see if there are room for improvement. And that's sometimes where these like injury cycles can happen, where an injury will pop up, take a little bit of time away, take some rest, take a break from running, and then jump back into training kind of right at the same level without changing anything else. It's no wonder that the injury is going to keep popping up because nothing else has changed. The root cause of why this injury popped up hasn't been addressed. So I think as frustrating as injuries can be, they can also be a really good opportunity to take a closer look at your training and at other variables that can impact developing injuries and make some adjustments there.
At their core, running injuries are almost always overuse injuries. So, this is the kind of chronic over time. You just do a little bit too much too often so that eventually it will fail versus something like an acute injury. This is I tore my ACL because I, ran into a tree while I was skiing, or I tripped and fell and I sprained my ankle. These are not the running injuries we're talking about. We're talking about the chronic overuse injuries. And at its core, like I said, this overuse injury is just a chronic overaccumulation of load over time. And talk to me about that, because this is what makes running injuries, I think, so tricky, is that it feels like they can come out of nowhere, but they've been usually brewing for quite a while.
Yeah, absolutely. And I'm so glad you mentioned that because I think you're totally right that a lot of times these running injuries that the most common running injuries that pop up, and yes, there can be freak accidents sometimes where you trip off a curb or whatever, but most of the time these running injuries are these overuse injuries that are kind of a buildup or a combination of things over time, which I think can be frustrating for runners sometimes too, because they like to be able to pinpoint, okay, this is exactly what caused my injury and this is what I need to focus on to fix it. And a lot of times it's a little bit more complex and involved than that. So the way that I like to think about running injuries, and I feel like this is hopefully a helpful analogy, but I like to think about it because I also think that running kind of goes hand in hand with a lot of runners are also enjoy drinking coffee. So this is hopefully a helpful analogy for understanding kind of why running injuries happen. But I like to think about it as pouring coffee into a coffee cup, right? So when when a running injury pops up, it's when the external loads placed on our body are more than our body is able to tolerate in that given moment. So we can think about this as a coffee cup and pouring coffee into a coffee cup. And if you pour a little too much coffee, it's going to reach that point where it overflows. So I think this is a helpful way to think about injuries because it can also be helpful for thinking about different ways to help address injuries, right? So the ways to stop this overflow from happening, there's a few different ways to approach that, right? You can manage how much coffee you're pouring at once, or you can get a bigger coffee cup so that it can handle more load, or you can do both. So the things that are helpful for building our body's capacity to be able to handle more or for building a bigger coffee cup are things like recovery, giving your body enough rest, ramping up your training slowly. So not pouring all that coffee all at once, maybe pour it a little bit more slowly. Making sure you're sleeping well, making sure you're fueling well, strength training. So, loading the areas of our body that have to take on the most of the load when it comes to running, just making sure those areas are strong so that they're able to handle the loads of running. So that's a way to kind of like build our internal capacity. And then we can also manage the flow of coffee or these external factors. So just making sure to kind of build up training slowly, being mindful about adding new things into the mix, taking down weeks, taking rest days, gradually ramping up mileage, gradually ramping up speed. So these are all different factors that can play a role in an injury developing or in areas that we can focus on for helping prevent injuries from popping up.
This is a tricky area though, because we also, and I say we colloquially as, kind of coaches or educators or people in this space, will also then on the other hand say, oh, but some degree of minor aches and pains is normal, especially when you're going through a big training cycle. So this could be a confusing message to a lot of runners who are on one hand being told, you know, injuries happen, but we try to prevent them whenever possible. And, these are all the ways to manage injury and how important it is to be cognizant of that. And on the other hand, we're saying, oh, yeah, some minor aches and pains are fine. Like, just run through it. You'll probably be okay. This is so confusing for the average runner to think, well, which is it? Should I run? Should I just keep going or should I stop and freak out?
Yeah. Oh my gosh. Absolutely. Yeah. And I feel like it makes it even harder when you're getting kind of like conflicting information and messages about this too. So the way that I like to talk to my athletes about this is just kind of making sure that they have like clear guidelines in place as far as what's okay to push through and when we should pay a little bit more attention to that discomfort and use it as a sign to kind of dial things back. So I think just having clear guidelines in place is really the key to being able to navigate those types of situations.
I think context is so important here. So I'm going to throw out some hypotheticals and
Yep.
say, all right, so if I'm a runner who comes to you and I said, hey, Alyssa, I have some soreness in my hamstring. And then in one situation, I tell you I'm just like hanging out in a base building phase, nothing big, but my hamstring is now sore. Versus I'm in a peak week of marathon training and now my hamstring is sore. Would your initial response to those two situations be different or the same?
It would absolutely be different. Absolutely. Yeah. And I think that's like an important thing to keep in mind too, is just looking at the athlete as an individual and looking at the bigger picture of where they are in their training. What does their cumulative training load look like? where are they at in their training cycle? Because I feel like a lot of times, unfortunately, little niggles and things can pop up closer to the end of a training cycle, or sometimes even in the taper, and that can be really stressful for athletes to experience. But a lot of times at that point, especially if it's just something kind of minor that pops up, it's just a matter of making some small tweaks and adjustments to dial things back a bit so that they can get to the starting line feeling as good as possible. If it's somebody that's more in like a base building phase and there's not a race kind of looming on the calendar, then we can address things a little bit differently.
When a runner comes to you for help first time with an injury, I'm just generally curious.
Yeah.
Typically, how often has that runner been experiencing the issue before they finally come and see you for help?
Um, it depends. There's definitely some variety there. I would say a lot of the runners that I work with have been experiencing the same injury for a while, or have sought help for it elsewhere and weren't able to fully overcome the injury. So I have a lot of people come to me after they've been experiencing for a while and experiencing an injury for a while and haven't been able to get the results that they want.
Yeah, so it's okay. This is still happening. I don't know why. That is one of the most frustrating things about injury recovery or injury in general is that sometimes, like you said, they just happen and it can feel like you're doing everything quote unquote right. And yet this is still happening. So then we get really bummed out because we think, uh-oh, there's something really wrong with me.
Yeah, absolutely. And I think that that is, dealing with the mental side of an injury can be really, really tough too, especially when you feel like you're doing everything right and it's still not getting you to where you want to go. And I think that's a lot of the athletes that I work with. That's kind of the state that they're in when they when they come to see me. They're just like frustrated and need a new perspective on how to handle the situation that they're in.
So let's back up and talk about this injury cycle. And I would like to share some of my experience with injury. And if you want to talk about your experience with injury as well, because again, injuries happen. So in my career as a runner, I've experienced IT dance syndrome. That was absolutely a too much too soon injury. I went from like 0 to 40 miles per week. I had some shin splints. And funny enough, I used to get shin splints when I played soccer in high school and I would get them like during preseason, the season every year. And I don't know what I thought. Like, I just thought it was that like my cleats didn't fit. And like by the time I got halfway through the season, like my cleats were broken in and my shin splints went away. Of course, now in retrospect, I'm like, oh girl, like you just adjusted to the load. Like when you're 17, you can do that pretty quickly. So yeah, shin splints, IT band syndrome, perineal tendonitis in my left ankle, like general left-sided funkiness. Again, kind of random aches and pains in there, but all of the injuries that I've experienced occurred in a time where I was just doing too much. In retrospect, it's easy to see that, but in the moment, you can't necessarily see that. I just thought I'm doing all the things that I need to be doing to achieve my goals, and all of a sudden my body is failing me. Oh my God. What did I do wrong? Maybe if I ignore it, it'll go away. Or if I just rest for a couple days, it'll feel better and it'll go away. And then I discovered, oh, you can like do strength training and rehab for this kind of stuff. But I do know that there are a lot of situations where if my IT band syndrome had just magically gone away, I don't think I would have done any follow up on it. And then the next time, if it had happened again, I'd have said, well, it just disappeared last time. I'm sure if I just wait it out, it'll go away again. I would imagine that that situation is not unique to something that I would have done, but explain why the I'll just wait for it to go away strategy is not the strategy we necessarily want to employ in dealing with these injuries.
Yeah, and I think this is a great question because I think that is a lot of times the common response to having an injury or something pop up is like, okay, I'm just going to rest for a little bit and then I'll be able to, once it feels better, then I'll go back to running the way that I was before, and completely understandable why that would be such a common response. The reason that this can sometimes become a problem, and again, sometimes it depends on what it is. If it is a small little niggle that pops up, sometimes that is exactly what you need, just to take a rest day and wait for it to feel better, and then you're good to go. So it really kind of depends on the situation too. But a lot of times when it's more of like a true injury that's present, the problem with this strategy of just resting is it's removing the stimulus that is causing that area to feel aggravated. But by resting, it's a temporary solution because it is offloading that area. So, of course, by kind of removing that load, that area is going to feel better temporarily, but it's not changing anything else. So, with absolute rest, with complete rest, that injured area becomes, it loses its loading capacity. It loses its capacity to be able to handle load. So by just removing that load and then jumping right back into running, that's with nothing else changing, that same area is still not going to be able to tolerate that level of load.
So in this situation, we'll go back to, I love your coffee and coffee cup analogy. So in this situation, right? So let's say, let's do the IT band. So say like my IT band is the coffee cup that we're pouring coffee into, and we're overfilling it. So we stop pouring coffee, right? So then in this situation, the coffee drains out, right? Our coffee cup is fine. It's not overfilled anymore. But you're saying if I just rest only, the coffee cup stays the same size, or it might actually get smaller if I don't do anything for a while. And then I go ahead and try to pour the same amount of coffee back into this cup and then rinse and repeat.
Exactly. So yeah, with an injury, we lose loading capacity in that area. So your coffee cup shrinks. So it won't be able to handle the same amount of load, the same amount of coffee. So that's when we need to kind of make changes and address other things to be able to increase that area's capacity to be able to handle more.
When a runner comes to you and says, "Hey, I'm an injury prone runner, a self described injury prone runner," what kind of questions come to your mind? What immediately do you want to know more of about that runner?
Yeah. So the first thing I'll ask is, tell me more about your injury history, because a lot of times if somebody is in this injury prone cycle, the reason why they're having injuries pop up is because their previous injuries were never properly addressed. So it could be just from these previous injuries that were never fully resolved that are leading to these current injuries popping up. So injury history, I think, is super important to understand. And then just talking about their training. What does your training look like? What are you training for right now? And getting into the nitty gritty of like, has there been a sudden increase in your mileage? Did you just recently add strength training into the mix? Did you start running in a hillier area when you weren't used to running on hills? Like, just looking to see if there is any kind of new variables that were recently introduced that could explain or be a contributing factor to the injury that they're experiencing. I think it's also, I always like to talk about kind of other factors outside of training that can play a role. So I'll ask about stress. What stressors do you have going on in your life right now? Is it more than what you typically experience? I'll ask about sleep. I'll ask about, are you taking rest days? Like, what does that look like for you? Let's talk about fueling. Let's talk about nutrition. So really just trying to make sure that I get a big picture view at everything that's going on. So that way we can have, it's easier to find a good starting point and see what areas there might be some deficiencies or some areas that we can pay closer attention to and make some changes.
This is probably going to be a question that is too general to answer easily, but how often do you find a really easy, immediate answer right away?
I do think a lot of times it actually is a little bit more simple than it might feel like for the runner, because again, like runners are very motivated, and they will do what they care about running. So they're going to, if you give them a game plan, they're going to stick to it and they're going to follow it. So I think a lot of times, like, runners are already doing a lot of things right. So it's not necessarily a situation where we have to go back to the drawing board and revamp everything. A lot of times it is a matter of just kind of adjusting some things and making some tweaks to their current training.
What is that threshold for you if you were in a runner's mind and they were going through this process of wondering, is this something that I should just keep running through and keep an eye on versus is it time to go see somebody? When would you like raise your hand and be like, okay, now we're at the point where you need to take this seriously?
There's a few different things that I like to talk about around this, because I think a lot of times runners will have the tendency to be like, oh, if it's not that bad, then I'll just run through it. And sometimes that's not the best approach. So I think having kind of like a clear idea of when that's okay and when to maybe dial things back a bit can be super helpful. So the way that I like to think about it is, typically if it's something that's kind of like mild and tolerable, and especially if it kind of like warms up as you go. So a lot of running injuries are tendon related injuries. And when dealing with an injured tendon, a lot of times they will kind of warm up. They respond well to certain levels of load. So they'll warm up as you go. So if the discomfort that you're experiencing is mild, is tolerable, and either stays mild and tolerable as you're running, or warms up and improves as you go, then you're probably okay to keep pushing through that, keep training on that. Um, and I think it's also helpful to monitor kind of symptoms both during and after activities, because sometimes, again, with tendons, things might feel great during and you're not getting that pushback until after the activity is over. So kind of monitoring how things are feeling in the 24 hours after a run as well. So if things felt great during, and then the next day you wake up and you're like, ooh, I'm really sore, then we might have pushed it a little bit too far. If you went for your run and things stayed kind of mild and tolerable, and then the next day you wake up and things are back to normal, back to baseline, then we're okay. We're in the clear. I think the things to look out for are if you're having discomfort that is starting to get into these higher, more intense levels, or if you're experiencing pain that gets progressively worse as you're going, that's when we want to kind of proceed more with caution. And if you're having pain that is changing your gait, that's changing the way that you're running, you feel like you're limping or you feel like you're compromising your form in some way, then that's a no-go. We don't want to run through that. Or anything where you feel like I need to take an anti-inflammatory in order to be able to do this run, then don't do it. That's not a good idea. So
Yeah.
higher levels of pain that is causing you to change your form, or pain that is getting progressively worse as you're going, those I would say would be red flags to kind of dial things back and maybe steer clear from running for a little bit. I also think sometimes too, if it's like, even if the pain that you're having is this kind of more mild level of discomfort, but it's just not going away, then that might be a time to go and get that checked out.
Our brains love loopholes. It's not just a runner thing, it's a human thing. So I'm going to go ahead and describe a loophole that I thought that I'd found that I want to share with all of you because you can know that this is not how you're supposed to do it. So knowing about that, if you're when you start your run and you warm up into your run and it starts to feel better, or at least gets a little bit better, not worse, that does not that's different from, okay, yes, it might feel better when you're running, but it's getting worse overall, even if it still warms up in your run. So the perineal tendonitis that I was experiencing would feel like I would warm up into it. Like I'd be, as long as I did a big warm up and like was serious about it, I'd be fine on my run, but it kept getting worse in between runs. So like, I was like, no, but it's fine. Once I start running, it feels fine. Except like the next day it was just worse and worse and worse and worse until I was like, I need to go to PT.
Yeah, and I'm so glad you mentioned that because I think that that can happen too. And that's a really good point of just kind of monitoring how things are feeling overall. And that was a point that I forgot to mention too. If the pain that you're experiencing is affecting your day-to-day life, that's not okay and go get it checked out.
I think one of the reasons that we react so strongly emotionally to injury is because we are so focused on trying to do this big thing. Anything that gets in our way, we don't even want to pretend exists. So the first reaction I know to a lot of potential injury for runners is kind of going back to that 5 stages of grief thing, which I don't even know it's a real scientific thing, but it is a helpful framework. That first stage, denial. No. I'm not injured. This is fine. And then, but you might be injured. How
Right. Oh,
oftentimes when you're working with runners who are going through this process, they come in. I'll use myself as an example. When I finally got into PT for my tendonitis, I was like 4 weeks out from my race. I was 4 weeks out from a marathon, and I was like, I think I have a problem. And of course, I should have known better. And luckily, I skipped. I was able to, and I should have, and I did skip that race. And I was able to run a different race, like 6 weeks after that. So I had a happy ending. But long story short, I waited until 4 weeks before race day until like limped into my PT's office and are like, I think I actually might have a problem. Tell me I'm not the only one.
oh my gosh, for sure. That is such a common experience. And I think it's exactly like you said. The denial that this is a problem or like hoping that it'll just kind of clear up on its own if I keep running or, oh, it's not that bad. I'm still able to do X, Y, and Z. I think those are very real factors that runners struggle with when dealing with an injury. And it can be hard to know when is that time to be like, okay, now is the time to go get it checked out. I think something else that can play a role in that too is that a lot of times runners are scared to go seek help for an injury because they're worried that the medical provider that they talk to is going to say, no, you can't run through this. Like, oh, you need to stop running. No, you can't do that race. And like you said, these big goals that we're chasing are really important to us, are really important to runners. So that fear of being told, no, you can't do this thing that is really important to you, I think can be really scary for a lot of runners too.
That's a really important conversation that I think we need to have about taking a step back from that very, very specific short-term goal and really zooming out about what it would mean to run through or run with an injury like that, especially through a race, which is hard, right? You're going to push yourself.
Right.
I do know that some people do this. I would never recommend it, but we've seen people talk about, running Boston with a stress fracture, running this with a torn that, running, and it's weirdly held up as something that's impressive. Like we're applauding that person for potentially damaging their body further with an injury. And I really would like to change how we talk about these types of things.
Yes. Oh my gosh. I'm so glad this is coming up in this conversation because I agree that this is such an important thing to talk about. And you're right. I feel like these sort of things, like we see them and they're kind of like glorified, being like, oh, wow, they're so tough. They were able to push through even though they had this injury. And I feel like that kind of contributes to runners feeling like, oh, it's fine, like I'm tough enough, I'll just push through this injury, and it can kind of contribute to people making those sort of decisions when it's not necessarily the best for their health or for their long-term running career. But I can see why it's so easy to get caught up in that when it just feels like it's everywhere, especially like on social media and stuff. You're just constantly inundated with the same kind of stories and messages. But I do think that things are starting to maybe shift a little bit more away from that. And that's definitely like, that's a conversation that I have with my athletes a lot. When there's, if an injury pops up and there is a race on the line, is just kind of zooming out and looking at things a little bit more from a bigger picture, instead of just being so hyper fixated on this one goal, and kind of weighing the pros and cons of it with them. I'm never going to tell somebody, no, you absolutely shouldn't run this race, but like, let's talk about why this is a good idea or maybe not a good idea, and help them make the best decision for themselves. In some situations, absolutely, if it is a more minor injury that they're dealing with, a minor niggle, sometimes it might be like, okay, we absolutely can still run this race, but these are the adjustments we're going to make in the meantime. Or sometimes it's like, okay, I know this race is really important to you, but let's think about what the potential consequences are if you run through this injury. Is that worth it? Let's, if you want to continue and have a long and healthy running career, maybe it's the best option to forego this race, get you 100% healthy, and then let's set our eyes on another race, because there's always going to be other races, right? And I think sometimes too, when we're so focused on a specific goal, it's so easy to feel like that is the only race in the world, or it's like this super all-consuming important thing. And sometimes it can be helpful to just zoom out and be like, okay, I can let this one go and I will pick out another one, and it's not the end of the world.
I'm gonna play devil's advocate here for a minute though,
Yeah.
because I mean, there are more runners than ever, which is so exciting, but that also means that the big races especially are harder and harder to get into. I think the New York City Marathon now has like a lower acceptance rate than Harvard does for the lottery, that is. It's like you have to apply in the traditional sense.
Insane. Yeah.
But think about, Boston, New York, Chicago, London, even just bigger destination races that also are hard to get into. You so many, I know, I work with them too, runners who would go to you and say, okay, I hear you, but this is New York City Marathon we're talking about, or whatever their big race here is. I've been applying to this race for 15 years and I finally got in. And now you're telling me that I might not be able to run this race because of my injury. There is a lot wrapped up in those situations, and it sucks for everybody involved. How would you go ahead and navigate a conversation with an athlete who is coming to you and said, but this is a once in a lifetime, or so I think it is, opportunity for me?
Yeah, and that it's a really, really hard conversation to have with people. And I think it so much just depends on their current situation that they're dealing with. If it's the sort of thing where it's like, okay, like you can run this race, but it'll probably flare up your symptoms, but it's not a big deal after the race, then we can kind of go back to the drawing board and address things to get you feeling 100%. Then, okay, fine. If that's the risk that you're willing to take, then I support it and I'm here for you, and we'll figure it out together. If it is a more severe injury, like a stress fracture, then that's where we kind of have to have the conversations of like, okay, look, like we're talking about your long-term health here. So, like that that has to be more of a priority than this specific race. And even though it's devastating to have to let this race go, like your health as a runner overall is so much more important than this one race.
There's a lot of shame when it comes to being an injured runner, especially in a situation like this where, again, this I don't want to be seen as weak. I want to be dedicated. I want to push through. This is very important to me. But now I'm injured, and so I probably shouldn't run this race. But I've told people I'm going to run this race, and they're expecting me to run this race, or I have this stated goal that I've been talking about, and I feel the obligation to fulfill that promise or that goal that I was talking about. And then we get into this weird, like, it's my fault, but like it's not my fault if I pretend it's not happening, it's not real. Like, this is a really hard time emotionally for runners, whether or not there's a race on the horizon. This feeling of, oh my God, did I do this to myself? Is there something wrong with me? I don't want to tell anybody. I don't want to acknowledge it. I just want it to go away.
Yeah, and that it's so hard. It is such a mental game that comes along with experiencing an injury, and there is a lot of that guilt and shame and fear of judgment and all of these very intense emotions that are involved with navigating that sort of situation. And again, it can feel really isolating too, especially, again, in the era of social media, when you're seeing everybody else continuing to train and are healthy and are doing crazy things and still making it to starting lines, and you're like, why me? Why am I the one dealing with this? So I think it can be a really tough situation to navigate, and it's kind of a balance of letting yourself feel your feelings. Like, if have an injury, you should be upset about it. It's okay to like let yourself be angry or sad or whatever big emotions are coming up around this. Like, that's a very normal part of the experience. So don't try to like push those emotions away too much. Like, let yourself feel those feelings, but also don't get stuck there forever. Give yourself some time to feel your emotions, and then take a little bit of a step back and say, okay, this sucks, but how do I move on from this? What are the things that are within my control that I can do now to help make this situation better? So I think kind of like having that shift towards focusing on the things that you can control can help it feel a little less overwhelming and a little less devastating.
I do work with plenty of runners who are struggling with these recurring injuries, and also recurring or chronic injuries that always seem to be different, like playing whack-a-mole. Like, oh, this, and then that resolved, but then this popped up, and then that resolved, and this other thing popped up. When you have a runner dealing with a series of recurring injuries, as in like it's or a chronic injury, and that's the same thing, like my left IT band just keeps flaring up. What does the recurring or chronic component of this situation tell you?
Yeah, so if it's the same area that continues to be bothersome, or even like what you were saying, if it's different ones that are kind of popping up, a lot of times those different ones, even if it seems like it's different injuries, they're kind of linked to something previously not being addressed. But a lot of times it's just a matter of uh, again, going back to that kind of like loading capacity thing, if that area isn't strong enough to be able to handle the loads that are being placed on it during running, then that's most likely what's causing the problem. So is it a matter of changing your strength training? Is your strength training challenging enough to actually build the capacity in that area? Is your strength training running specific enough to challenge that area? So looking at things from a capacity side, and like I know we were talking about earlier, as like a lot of the injuries that runners face are these kind of overuse injuries. I like to think about them too as an under preparation injury more than an overuse injury. So your body, or that part of your body, wasn't at that period of time prepared for the amount of load that was placed on it. So what can we do to improve that area's ability to be able to handle more? Training load is stress, but there's other factors in our life that are also stressors, and our body doesn't know the difference between life stress and training stress. So that's where it can be a little bit hard um, to differentiate, or to predict accurately how we're going to be able to handle load on a certain day. So I think it's just helpful to be mindful of those more, those other external factors that can play a role too. But yeah, and that's kind of uh, a key component to being able to overcome an injury, right? Because of our bodies are really resilient and they're really adaptable. So loading injured areas is a key part of being able to overcome that that injury. Being calculated in how we're loading a certain area and just being mindful of how that area is responding and using that data and using that information to kind of make next best steps. But we want to load that area and see how things um, respond and let that area adjust and adapt. And then if that handles that well, then next time we can add a little bit more.
We tend to think of our bodies in this monolith as if we're just like one block of tissue. And thinking about this loading, right? How much can I handle? How far can I push myself? And we tend to think of, I can handle this in like a whole body way, except not all of our tissues can handle the same amount of things at the same frequency. So then we get stuck kind of misunderstanding what our needs are. And I'm tying this into the something you mentioned earlier in our conversation about asking questions of an injured runner. What has changed recently? Did you add strength training recently? Because one of the first steps that a lot of runners take when they are experiencing injuries, they go, oh, I heard that strength training is really good for injury. I'm going to start strength training a lot. But then we're adding more load on top of the thing that's already struggling to handle the load that's already on it. And then we wonder why we're not getting better. Can you talk to us about the role that strength training plays in all of this?
Right. Yeah, and I'm so glad you're bringing this up because I think it is important to talk about, and I think that a lot of times, yeah, runners assume that that's the missing piece, and it's like, oh, I just need to start strength training, and that will help, and that's not always going to be the most helpful thing. So I love strength training. I think it's incredible. I think it's super important for runners to be doing, but it's also not the end all be all. And like you were saying, it depends on kind of what's going on and where you are in your training cycle to introduce this new load, especially if it's something that you've never done before and it's brand new. Your body's going to need time to adapt to this brand new stimulus that's also challenging and loading through areas that you're already using a lot with running. Also, too, a lot of times runners have this tendency of doing a lot already because, again, like we've been talking about, they care so much about their goals that they're already doing, they want to feel like they're doing everything possible to get them closer to those goals. So they're already doing a lot. So adding another factor, another new load, another new stimulus into the mix actually could have the potential of making things worse instead of better. And I think that's, that can be hard too, especially when on social media we're seeing these posts of like, do these 3 exercises and your knee pain will be gone forever, where it's kind of just making it seem like it's super simple and you do these couple exercises and you'll never get injured again. But that can have the potential of flaring things up and making things worse. So in some situations, in some with some injuries, adding strength training into the mix can be a super helpful and valuable component of overcoming that injury. A lot of times it's just a matter of cutting things out and doing a little bit less and seeing like where can we pull these levers and dial things back to find a tolerable level and then keep building from there.
I'm very glad that you brought up managing training load management. Something that I talk to my athletes about. I said, this is the least sexy, most important thing you need to understand about your training is training load management.
That's a perfect way to describe it.
Right? Seriously. But like I said before, or like you said before about a lot of runners are hesitant to go and seek treatment for an injury because they're afraid they're going to be told to stop running. I've worked with plenty of runners who have a very similar reaction to being told they need to slightly decrease their training load. I'm like, maybe we should do fewer speed workouts in a week right now while we're getting this figured out.
Yeah.
Why are we so to the max all the time? Why are we so afraid of doing a little bit less, especially while we are actively rehabbing an injury? I don't get it. I'm asking you. I don't know why.
Yeah, no, that is such a good question. And it's really hard. And I think a lot of it comes from like we have this idea that more is better. So like I constantly need to be doing more. If I'm not doing everything possible, then I'm leaving like progress on the table or I'm leaving gains on the table. So I think it can be really hard to shift away from that mindset, especially like I think it is kind of like ingrained in us. And again, going back to like we see these crazy things on social media or talking to other runners or whatever, and it just feels like, oh, am I not doing enough? Am I not, they're doing all these crazy runs and they're seeing these crazy results. Like, is that what I need to be doing? So I think there's a lot of reasons why we tend to kind of gravitate towards that mindset. And I think it's hard to shift away from that too. I think, part of it is just we are like runners tend to be kind of high achievers. So we put this extra like pressure and stuff on ourselves to like do the most and do the best. It's hard conversations. And there's a lot of times there's like underlying things that are contributing to someone approaching training in that way. So I think, like our role as coaches can be to have those hard conversations sometimes and just being like, why do you feel like you need to train in that way? And like, let's dive into that a little bit deeper and see why you're feeling that way. I think sometimes too, it's just a matter of kind of like understanding and just like thinking about training in a different way or hearing about training in a different way where, like I'll have conversations with my athletes about how rest and recovery are a crucial part of training. It's not like an either or thing where it's like, if I'm resting, then I'm missing out on this run that I could be doing. It's like, no, your body needs that chance to rest and recover so that you can keep training, and you'll get more out of your training if you give your body that chance to rest than if you're just constantly grinding nonstop.
Let's talk about becoming a more durable, resilient runner, since I know that is a key part of your entire work, including your business. And I will talk broad strokes. Let's talk the basics. If somebody is on a mission to become a more durable, resilient runner, what are the key pillars to focus on? And then we can get more and more specific.
Yeah, no, I love this question. I think the key things, and it's kind of tying back into a lot of things that we've already touched on in this conversation, is just looking big picture as at your training as a whole. What percentage of my training is easy running? Am I actually running easy on my easy days? Am I taking rest days? Are there down weeks factored into my training? So I feel like those are kind of like the basics on from like a training plan perspective. And then also looking at the outside factors that we've touched on too. Is this a period of my life where I'm dealing with a lot more stress than I normally would be? Does that mean I need to dial things back in my training a bit too to be able to handle that sort of external stress? What does my sleep look like? What does my nutrition look like? What does my strength training look like? If I'm not strength training, is this a good time to introduce that? Or do I have a race in 2 weeks? And it might not be smart to add something brand new into the mix. So I think those are really kind of the key things. So just looking at training as a whole, and then these external factors that can also play a role in how we're able to handle load.
It does seem to me that these issues can appear when there is a mismatch between the runner that we want to be and the runner that we're currently capable of being.
So I think a lot of it is not letting ourselves play the comparison game, whether it's comparing to another runner and what they're doing, or comparing to a past version of ourselves, like, oh, before I was injured, I was able to run X amount of time or whatever, and just truly like helping an injured runner like meet themselves where they are right now. Because I think that focus on kind of that external, these external factors or these external goals can lead to runners making these kind of like hasty decisions with their training, or kind of not necessarily always making the best decisions when they're training. And that can kind of tie into that mindset of like, oh, I need to be doing more. I need to be doing more. I want to be able to do this. I'm not doing this right now. Like, I want to be able to get there. So I'm just going to do a million things all at once. I think that, instead of like focusing so much on the external factors, like helping a runner kind of meet themselves where they are right now. And instead of like focusing on this big goal or this is where I want to be and I feel like I'm so far off from this right now, like, okay, let's see where we are right now, and let's focus on the steps that we can take to inch you closer to that bigger goal. And I think that also ties into what you were talking about as like with timelines. Like, sometimes these big, scary goals take a long time to reach. It's not going to happen in 6 weeks or 12 weeks. Sometimes it takes months or years to be able to reach that point. And that doesn't mean that you're not making progress. That doesn't mean that you're not making steps. But I think just kind of like setting realistic expectations can be really helpful for people too. And I think also too, like focusing on things with running and with training that go beyond these big scary goals that we're chasing, right? Because if that's all that we care about, that's when that like all or nothing, all in mindset, that's where these things like burnout and injury can pop up and can happen. So focusing on the things that you can control, breaking these big scary goals down into smaller bite-sized pieces that you can kind of chip away at and check off along the way. And then also finding ways to have fun with the process of training and celebrating your progress as it comes, instead of putting so much weight on this one big goal that's far off in the future somewhere.
The big thing I know for injuries, everybody wants to know exactly how long it's going to take to fix the injury. And like I said, with timelines, like we both said, nothing happens overnight. That when we are really thinking about full, I don't hate to say 100%, full resolution of an injury, just like many components of our fitness, this can take a lot longer than I think we even recognize, much less want to understand. And I know that I have had some tough conversations with runners who are currently experiencing an injury and have a big goal that they're trying to achieve later in the year. Do you have conversations with athletes about this and say, hey, look, we're trying to get you pain-free as soon as possible, but the full, true 100% resolution of this thing is going to take longer than you realize?
Yeah, absolutely. And I think that is such an important conversation to have with athletes early on in their recovery process, and setting realistic expectations and just being clear. Like, I'm not saying that you can't run New York, but I just want you to be aware that there's a possibility that the injury that you're dealing with right now is not going to be 100% resolved by the time you get there. But I still feel confident that you'll be able to toe the line and run the race that you want to. Yeah, and I think that's a hard pill to swallow for runners sometimes, is they think of injuries as just being this kind of like short-term thing, and it's like, oh, I'll just be out for a couple weeks and then it should be back to 100%. So I think like setting those expectations early and having those conversations early lets a runner kind of know what they're in for and can feel better about it, instead of just being like, oh my gosh, I'm still dealing with the same injury. I must not be getting better. when it's like, well, a few weeks ago you weren't running at all, and now you're running, you're up to 30 miles a week or whatever it is. So like seeing other ways to kind of um, notice progress, even if there's some discomfort still present.
How often, as you are asking their athletes about injury history and talking about fueling and stress, how often do you also suspect there is an underfueling component to the injury situation?
I would say a good amount of time, and that's why I always like to talk about it. And I think a lot of times runners can be fueling unintentionally too. It's not like a purposeful thing. But I think a lot of times it's just like runners don't realize how much fuel they need to really support their training at the level that they're training. So I think that can very often be a contributing factor, and that's why it's something that I like to ask about early on.
Are there specific injuries where you are strongly encouraging the athlete to also talk to a dietitian?
Absolutely. Yes. Any sort of bone stress injury, especially if it's at like a higher risk site, immediately go talk to a dietitian. And I'm grateful I have a lot of wonderful dietitians in my network, so I can provide those referrals and kind of set up that relationship early on and know that they're in good hands with the dietitians that they're working with. But bone stress injuries, a lot
I
of
would
times.
say we've done an episode on bone stress injuries, but can you tell people what you mean by a high risk site?
Yeah, so I love that episode that you did on bone stress injuries. Steph Munt is the queen of bone stress injuries, so she's a fantastic resource to have on the podcast. But what I mean by a higher risk site, and I would say anybody dealing with a bone stress injury, it's worth diving into those underlying factors. So any sort of bone stress injury that I come across, I will ask those sort of questions about nutrition, about menstrual cycle, about hormonal things that can play a role too. But high risk sites are ones that are there's a lower chance of them healing as well, because there's typically other factors that contribute to it, or there can be areas in where there's poorer blood flow. But there are certain bone stress injuries that there's been a lot of research to support that a lot of times if there's an injury happening in this area, most likely there is an underfueling component that is contributing to it as well. It's not as simple as just a sudden increase in load.
I think the way that Steph described it, which is how I've been using, is essentially the closer you get to your core, the more high risk it is. So, like, if if you have a stress fracture in your, I don't know, your fourth metatarsal in your foot, like, yeah, but also pretty high area for overuse for a runner in general versus like your femur or your pelvis. Like, those are really not great areas to have a stress fracture, like for a bunch of reasons, but especially like you said, for that underfueling component.
Yeah, and I think I love how you worded that. I think that's a great way to think about it, because these areas that bone stress injuries will pop up kind of more commonly are areas that are also loaded a lot during running. So yeah, like you said, your metatarsals or like your tibia, like a tibial stress fracture, I'm not as certain that there's an underfueling component. Whereas someone's coming with like a sacral stress fracture, then I'm like, there's probably some other stuff going on here, and we're going to take some time to really dig into all of that.
As we wrap up here, I know that listeners to this episode might have tuned in because they are experiencing recurring or chronic injury and are saying to themselves, I don't believe you. I don't believe that I can stop being a chronically injured runner or a runner who keeps experiencing injuries. Like, I don't believe you. That's crazy because up until now, like, I haven't been able to fix this. What would you say to somebody who is experiencing that frustration, rightly so?
Yeah. Oh, that's a hard one to answer. And I would say like just a reminder that like our bodies are very capable and resilient. And unfortunately, sometimes injuries can make us feel like they're not, but just trusting that you are strong and you are capable and you are resilient. And it's just a matter of finding the right starting point for you to be able to overcome this. I think a hard thing when it comes to this too is, and kind of tying into the question that you're asking, is that a lot of times people will feel like there's something wrong with them, or they've gone to physical therapy and the same injury is still there, so they feel like they failed physical therapy, or like something is wrong that they're never going to be able to get out of this injury cycle. So I think it's just a matter of, sometimes it's just a matter of finding the right person who really understands your sport and the demands of your sport to help you navigate these tricky situations. So don't be afraid to advocate for yourself. Don't be afraid to ask questions. If a medical provider is telling you something and it's not sitting quite right, like ask them questions about it, or you don't be afraid to break up with your PT and your doctor and find one that feels like a good fit and that can really help you.
And last but not least, I think the reason I bared this question at the end is because it's a tricky one. We're all different. We all inhabit different bodies and have different life experiences. And it is true that there are going to be situations where what we're trying to do is just not something that our bodies are capable of supporting.
Absolutely.
Now, it doesn't mean like you can't try all the things and try to get there, but I'm trying to give an example of myself. Like, I'm trying to think, yeah, there are definitely things that I will never be able to do no matter how hard I try. I just can't think of any yet. Trust me, there are plenty of them. But that is a really crappy reality to be stuck in when you're thinking, but this, like, I want to do this. And it does feel like I'm trying all the things and I can't get there. What kind of teachable moment can we get out of this for ourselves, and kind of pivoting away into, like you said before, having more than just that one very specific outcome goal? Because this sucks, right? But this isn't an episode where it's gonna say every single person, no matter who you are, can be injury free forever and chase all your goals until the end of time. This is like, hey, we're trying to keep you safe. You will get injured probably at some point. We're trying to make that happen as least often as possible, but there are gonna be situations where you might be trying to do something and your body simply will not be able to support it without getting injured. Have you ever come across a situation like this? And just thinking about it, what might we be able to learn from a moment like this?
Yeah, I think there's so much to be able to learn from a moment like this. And I think a lot of times it is just a matter of kind of like tying back to what we were talking about earlier. There's just a big gap between where a runner is now and what they're trying to accomplish. So it's not necessarily the, oh, you'll never be able to do this. It's let's meet ourselves where we are now and find ways where we can inch closer to that, and also find ways to be okay if we never quite get there. But there's other ways that you can notice progress and continue to enjoy running and enjoy training. So I think it's just a little bit of a reframe, and again, setting those expectations kind of early on as far as what that progress takes time and what this process is going to look like.
Alyssa, thank you so much for your time today. I'm really glad that we got to have this conversation. Unfortunately, I know that it's going to be useful for a lot of runners as we head into big spring race season. So if anybody's looking to learn more about you or looking for help with something that they might be experiencing, tell us, where can they do that?
Yeah, and Elisabeth, thank you again so much for having me on as a guest. I really hope this conversation was helpful for a lot of the listeners. I'd love to connect. So if anybody wants to reach out, Instagram is a great place to reach me at alyssaford.dpt. You can also shoot me an email at alyssa@resilientrunningpt.com, or check out my website at resilientrunningpt.com.
Thank you so much.
Thank you so much.